Hello, everybody. Welcome to the Healing Arts Podcast, where I get to talk with healthcare practitioners from a wide variety of different disciplines in an attempt to expand our conception of what is possible, what is legitimate, maybe a little bit of what is illegitimate about this world of health and healing, exploring some of these ideas. Today I had the great pleasure to talk with Christy Norton. She's a very well-accomplished, very effective body worker and an extremely sweet human being, I think. We talked about her journey of how she got to where she is as a massage therapist and body worker in general, because she knows a huge amount of different techniques, as we talked about in the conversation. The specific focus of today was definitely on lymphatic drainage therapy, a technique that's very interesting to me and has some obvious benefits that I've gotten to see with my own eyes on a variety of occasions. And so super deep delve into that, how it works, the theory behind it, some stories that she has seen in clients that she's had. It was a fascinating conversation. I hope you learn a bunch from it. I definitely learned a bunch from it myself, and come along for the ride. Thank you very much. Christy.
Hi, how's it going?
Good, how about you?
Very good, thank you.
Thank you for chatting with me.
Thank you for having me on the show.
You're very welcome. You're very welcome. So maybe we can start with you telling us all about how you got to where you got. Like, how did you get interested in body work? How did you get interested in being in this world? Yeah, maybe we can start there.
Sure. When I was in college, I had a back injury. And I don't know what caused it. I was in pain for 6 months. I ended up coming home to visit my mom from college, and she told me to go to her massage therapist. And I laughed at her and was like, okay. So I went to the therapist, and she literally fixed me in an hour-and-a-half session. And I had started doing yoga, exercising. I bought a new mattress. Nothing was working. And so when she healed me, I was like, there's something to this. If I could do this for one other person, it would be worth learning. And so I went back to California and found a massage school and dove in.
Awesome.
So
awesome. And can I ask more about your back thing? What was going on?
It ended up being a muscle called the psoas. Was what was injured. I'm not sure exactly how I injured it or why it was injured. But it was enlightening, and now it's actually one of my favorite muscles in the body to work.
Nice.
I was like, I gotta learn how to work this and be efficient and help people.
And that was manifesting as like a low back pain?
Yeah, low back pain.
Interesting. And so she went in an anterior and it fixed it right up, huh? It
fixed it. Yeah.
Right on. Like magic.
Yeah. I was shocked.
In one session?
One session.
That's crazy.
Yeah.
Very cool. I always love hearing stories of people who get into this world because of issues that they have themselves. Yeah, because I don't fall into that category. You know, I never had any issues, and yet I'm here anyway. But I think it's maybe a little more powerful. I think it's cool whenever it's like, oh, someone really helped me, like your story that you just described. So I think that's cool.
Definitely.
Yeah, very cool. So you went to school in California.
Yes, so I went to Santa Barbara Body Works, which was a massage school in California. And they had different programs. At the time, 1,000 hours was the highest accredited nationwide. And so they had a program like that, which is what I ended up doing. So it was a mixture of a bunch of different modalities. One of the modalities was lymphatic drainage, which is what we'll be talking about today.
Yeah, so that was part of the core curriculum?
Yes.
Oh, wow.
Yeah.
I've never heard of that. Is that because of the 1,000 hours gives you that kind of
It gives you options.
freedom?
So there was basic courses with massage that you would take, and then there was extra hours, and you could pick and choose what courses you wanted to learn.
Like electives.
Exactly. And anytime one would come, I was like, I need to learn that. It didn't matter what it was. I wanted that as a tool in my toolbox, because you never know what your client will have and what you'll need to be able to help them.
Totally. So what other kind of electives did they offer, and what other kind of electives did you take?
They had craniosacral therapy, which is a very subtle modality involving key rhythms in the body and working with slight decompressions to open things up. They had visceral massage, which is organ work, belly work to help with digestion, acid reflux, constipation. Pregnancy massage, where you learn a lot of side lying and the different risk factors with pregnancy, how to work with moms before labor, after labor, and even during labor. So I got into that a little. I did some labor and delivery massages.
Oh, cool.
So I've been to 13 labor and deliveries.
13?
You see the little come out is very cool. Very cool. Some were home births, some were hospital.
Even at the hospital you were able to do that work?
Pre-COVID. Yeah. So I'd be there with Dad, and it was awesome.
That's awesome.
Really cool.
That's awesome. I took a lot of pregnancy training in school also, but we never learned anything about specific to during labor.
Well,
I think that's so cool.
Yeah, the cool thing with pregnancy massage is that the brain receives pleasure signals faster than pain signals. So you're not eliminating the pain, but you're lessening it because of the pleasure signals. You
increase the pleasure, and then the pain kind of fades into the background a little more?
Exactly. And then there's reflexology points that you can hit on that will help with having the cervix open and relaxing the uterus for contractions, things like that.
What?
Yeah.
How come I don't know anything about this? I thought I knew something about pregnancy work. That's super cool.
Pretty fascinating.
That's awesome.
Yeah. And then reflexology. So that was another course that I did. So reflexology is points on the hands, feet, and ears that mirror parts on the body. So you can actually work the organs or the tissues through those parts of the body without actually touching them. So kind of ties into Chinese medicine. And
that's very cool. So all of those that you just mentioned are courses or electives that you took.
Mm-hmm.
Very cool.
Yes.
Very cool. Maybe what were some that you didn't take that you kind of remember that they offered? Do you remember any of that?
I did not take polarity therapy.
I don't even know what that is. Polarity therapy. What's that?
I'm not sure, actually, which is why I didn't take it.
Nice.
I think that's the only one they had that I did not take.
Oh, okay.
One of my favorites was shiatsu, which is like acupressure. So acupuncture, they're using needles. Acupressure, they use pointed rhythmic pressure along the meridian lines. And the background with Chinese medicine and the 5-element theory and all of that was amazing. If I had another lifetime, I would probably do acupuncture as well.
Nice. And I'm thinking of one where you where the client is on the ground or maybe on a table, but then you're like with bars and you're standing and you work with your feet.
Yes.
That's not shiatsu.
That's ashiatsu. Or
Ashiatsu.
at my school, they taught it as compressive deep tissue. So you were on a futon on the ground with pillows bolstering you, and then the therapist steps on you in specific ways. So really great for athletes and people that are hypersensitive or people that are not comfortable getting undressed because it can be done fully clothed, and the pressure is applied in such a way that it's not specific, it's more broad, and so people with sensory issues can handle that better.
Interesting. So shiatsu different from ashiatsu.
Correct.
Shiatsu is like acupressure type of stuff. Ashiatsu is feet work.
Mm-hmm.
Do you anything with the hands or elbow or anything, or it's all feet?
I believe it's all feet.
Cool. Very cool. And then you have bars.
Yes. I did not do the training with the bars, but I do have friends that are therapists that do that work.
Awesome.
I just use my feet. I figure I don't need bars. But
Yeah. You just kind of like stand on one foot and then kind of
exactly
like modulate with that.
Mm-hmm.
Yeah.
We had some people in our class as we were learning that were not as balanced. They were a little more unstable, and so some of those therapists ended up with really awesome like walking sticks, and so they'd brace with the walking stick and apply pressure.
Oh, that's smart.
So we did that in Santa Barbara, North Santa Barbara. There's a place called El Capitan Canyon, which is like glamping, and so they have cabins and yurts and tents, and as massage therapists there, they offer that compressive deep tissue, and so
very cool.
You'll see people with their sticks doing that. It's kind of fun.
Nice. That's very smart with the stick. Yeah, I think I've only ever seen it with the bars, but the stick makes sense. That's smart.
Yeah.
And then you don't have to hook anything up to the
Stay right
ceiling.
under the bars. You can mobilize around.
Oh, that's another smart thing. Okay, cool. Very cool.
Yeah.
Okay, so how did you pick your school in California? Like, what made you pick that one instead of...
Very good question. So the therapist here in Colorado that worked on my back, that helped me, she's like, if you're interested, you should look into massage. And I was like, cool. She's like, you need a massage school that teaches neuromuscular therapy, which is a specific way to release the muscles. And so I went back to Santa Barbara, California, and researched it and found a school that did teach that. So.
And that was the only one kind of in that area?
Mm-hmm.
I see.
Yeah.
I see.
Exactly.
Very cool. Very cool. And so how about this? How often are you using the different, because you've done a lot of different stuff. You've learned a lot of different techniques and a lot of different sort of, so how often are you picking from all of those different things as opposed to like, no, this is kind of like my core thing? And does that question make sense?
Absolutely. I do have clients that come to me on a regular basis just for maintenance work, and then I have clients that come for specific issues. And so as I'm massaging, I just kind of, before a session, ask them what's going on, what they need to focus on, and then use the tools that I have. And some clients request different modalities that I do. They're like, can you do some of this and this? And others are like, my shoulder hurts. Do whatever it needs,
And then you can pick and choose and here
exactly.
and there.
Yeah.
Very cool. Very cool. Okay, so let's get into some lymph stuff.
Okay.
I think. Maybe can you give us like some background of what it is like from a theory side? Like what's the idea behind lymphatic drainage therapy?
Sure. So there are 11 body systems, 12 if you count the enteric nervous system. Some people do, some people don't. The lymphatic system is one of those body systems. And with body systems, if one is off, then it can throw others off. So the lymphatic system is our immune system. It keeps us healthy. It filters. So it involves lymph nodes, lymph tissues, and basically, if you envision a lymph node, the way I like to picture it is an Easter egg. So you have an Easter egg, and whatever the bacteria, virus, toxin, whatever it is, it traps that in the Easter egg. And so as a lymphatic therapist, what we do is we stretch the tissue, which opens the egg, and then we torque it, which flushes it. And then it comes back. And so the lymph system does not have a pump. And so to get that fluid moving, major muscle contraction does that, diaphragmatic breath, exercise, and then massage can help. There are miniature trampolines. They're called rebounders. When I was a kid, I'm like, oh, it's a kid-sized trampoline. It's just a trampoline. But those are used medicinally for moving lymphatic fluid. And so it's not that you have to jump really high on a trampoline, but it's just the bounce that circulates your lymph. And in the base of your foot, there's an area that Chinese medicine calls the sea of lymph. It's kind of on the ball of your foot, and the lymph gets stored there. And so as you bounce, it starts to circulate it through the body.
Interesting.
Yeah.
Sea of lymph.
The sea of lymph.
The sea of lymph. On the ball of the foot, you said.
Exactly. So that's why the rebounder is beneficial. So as a lymphatic therapist, what we do is we move the lymph through the body. So the lymph tissue is kind of white and milky. It's textured, kind of slimy, like a loogie.
Nice.
And so it flows throughout the body and collects the toxins, and then it gets filtered out through the blood. So it's a circular system. So it starts as lymph, collects things, and then gets filtered through the blood, and then the blood separates back out to the lymph, which is an interesting concept.
Yeah.
The way that it works.
Yeah, like parallel circulatory systems in a way.
Exactly. There are 600 to 700 lymph nodes in the body that are large enough that we can see without a microscope. Generally, they are at joints, so everybody knows about the ones in the neck, axillas. It's around breast tissue, the groin, any of the joints, so knees, ankles is where the majority of the lymph nodes are. And then there are millions of microscopic ones. There's a bunch around our intestines. So we need them around our intestines because if we eat something that has a bacteria on it, as our body is pulling in the nutrients, the lymph there is supposed to catch and trap that bacteria to keep us healthy.
Well, bacteria, huh?
Yeah.
Yeah, I've heard that every single organ has a microbiome, not just the lumen of the intestines, not just the inside of the intestines and stomach and etc., but also like every organ, like a liver and spleen and everything has like a brain, everything has a microbiome of bacteria and stuff. And so the lymph will sort of like wash that through and wash that out. That's what you're saying?
Yeah, filter what needs to be filtered and help keep everything in balance. If we have a very specific bacteria, and there's good bacteria and bad bacteria, and people are under the idea we don't want any bad bacteria, but you have to have a balance between the good and the bad for our bodies to function correctly. And so the lymph helps keep that balance.
Oh, interesting. That's cool. Yeah, it's more, what's the word? I'm trying to think of a word. It's, yeah, like the conglomeration of the whole thing. Oh, there's such a specific word I'm looking for. Well, anyway, yeah, just like the conglomeration of the many different ratios and the many different types, I guess, right?
Mm-hmm.
So, yeah, that's cool. Yeah, not just... So if you had zero bad ones...
The good would overcome, and it actually would be negative.
And it could be counterproductive.
Mm-hmm. Yeah.
That's so... that's very cool. That's very interesting. It's like... I'm reminded of... there's a guy I like very much, Ian McGilchrist, and he likes to mention how if you go too far into one direction, it'll eventually be counterproductive. Mm-hmm. And you get away from the thing that you were trying to get to. You try so hard to do something, and then it'll end up...
Like a rubber band, it just rips you back.
Yeah. It'll come back around and be not good. So I never thought about that with the bacteria ratios and different types. That's interesting.
Yeah. Well, in my lymphatic training, the instructor that I had, he was the main lymphatic drainage therapist in Santa Barbara. So he worked with the hospital there and did all of the cancer lymph stuff. So people will come to me for lymphatic drainage before a surgery or after a surgery, after especially to help purge out the anesthesia. And to keep things moving and flowing correctly. If your lymph is moving, your body will heal faster because the blood flow is not congealed or stuck. It's more mobile. But so he was my instructor, and he was the main lymphatic guy in Santa Barbara. Him and his wife had a practice there. And it was, I was very lucky to train under him.
And what was his name?
Alan Mills.
Okay, Mills. Cool. I don't know that name, but yeah, working with masters there's nothing better, right?
Absolutely.
Okay, so tell me what you think about this. I'd like to kind of go through the way I kind of understand how the lymphatic circulation goes, and you tell me what you think about this story.
Sure.
So we have, if we start with the arterial system, from the heart, the arterial system is pumping blood out into the periphery of the body, and then as those arterial branches get smaller and smaller, eventually they get so small that we call them capillaries, and then that's where you know all of this, but this is for everybody, and
Absolutely.
I just want to hear what you think about
Sure.
it. So as we get into the capillaries, then the blood is going to perfuse out, and then that's where we have the exchange of oxygen, nutrients, carbon dioxide, all that stuff, and then it gets pulled back into the venous system as it makes its way back into the heart. However, not 100% of that fluid gets resorbed into the venous system. Some of that fluid stays between the cell spaces. So we have, our bodies are packed in with cells, but they're not glued together. They're like they have a little bit of spaces, and so that space can get filled with this fluid. And so that's where the lymphatic system comes into play. The lymphatic system is kind of like pulling that that excessive fluid that didn't get resorbed into the veins, that's where the lymphatic system gets pulled. And then it'll travel through the lymphatic system and then eventually get dumped back into the venous system, exactly like you said. And I like adding that element of kind of like washing bacterial stuff, and that's a cool little addition to the story that I didn't know before. So does all of that sound good? Mm-hmm. All of that sound right?
Yeah.
And then so I hear all the time that the lymphatic one of the purposes of the lymphatic system is to pull toxins and like garbage, so to speak. So where does that come from? Why is that an analogy that I hear from everybody, that we get toxins and bad stuff, like in the garbage, so to speak? Where does that enter into the story?
That is a great question. I don't know.
Yeah. Cool.
I don't know.
Cool. Maybe because it's like stagnant, or like, I don't know. Maybe there's toxins and garbage that go into the venous system also.
I definitely agree with that. Our body is like a recycling facility. So our cells, each type of cell is programmed to die at a certain point. And so when it dies, our body has to recycle it, reabsorb it. And as we do things, there's different things that are running out. So like when we're working out and you end up with metabolic waste and lactic acid and those kind of things, the body has to deal with them and recycle them out or use them. So my understanding is whether it's in the lymph or the blood, as those things are getting reabsorbed and re-broken down and assimilated into new tissues and new cells, that's my understanding.
That's cool.
Of it.
Yeah, that's a cool answer. Another thing that's coming to me just in this moment is, I wonder if as that extracellular fluid that's just kind of hanging out around the cells that didn't get pulled into the veins, maybe that'll get stuck there for a couple days or for some amount of time, and that stagnation of movement, maybe it didn't start out as toxic garbage, but after a couple hours or a couple days or maybe a couple weeks, who knows, for a couch potato, maybe then it'll turn into toxic waste that the lymphatic system will then sort of be like, alert, maybe.
Exactly. Yeah. And the space that you're talking about, they would say it's filled with interstitial fluid. And so that fluid can become sluggish and stagnant. And so with lymph, it can become more of a solid and a gel versus the liquid that flows. So one of the things with body work is called thixotropy, and that is when, by applying heat and pressure, you can change something from more of a solid to a liquid state so that your body can filter it and flow with it.
Very cool. Very cool. Okay, so how does the touch of a lymphatic drainage technique differ from the touch of more traditional massage technique?
That is a great question. So with lymphatic drainage, there's a very distinct pressure that you want to use. If you apply too much pressure, you sink through the tissues to the muscular level, which is where most massage therapists are working. But if you're too superficial, then you're not moving the fluid. So there's a fine line between just connecting to the skin and sinking deep enough that you're moving the lymph fluids. And so the key with that is, one way that I teach it when I'm teaching lymphatic is, if you have a Ziploc bag with water in it, if you push the water, it goes to the other side. But if you stop pushing it, it comes back. And so when you are draining the lymph system, our joints have the lymph nodes there. So when you're draining, you want to get it past the joint, because the fluid will start to come back and the joint will then collect it. So if I'm doing my hand and I just take it to the joint, it will come back into my hand. If I take it past the joint, then the wrist will stop the fluid from coming back.
All the nodes in that joint space.
Exactly. So when you do lymphatic drainage, we always start proximal to distal. So if I'm working on the arm, I'm going to clear the axilla first and then work the upper arm and then bring it up. Because if I'm trying to move fluid from the hand all the way up, if this is jammed, it's not going to allow for the fluid to come.
You want to clear the traffic jam from the
original location.
From the original location first.
Yes.
So that the more distal stuff has space to move through.
Exactly. So proximal to distal is the way that we work.
But proximal to distal, still moving proximally towards the heart.
Think towards the heart. So everything drains towards the heart. The main area is the jugular, and it drains into the terminus. It's called the terminus. It's right below the collarbones. And so first we always clear the neck to get it open so that things can move. And then you can work on whatever area you need to work on. So if I'm doing arms, I would clear the axillas first, and then the arms. If I'm doing legs, I would clear the inguinals first, and then bring the legs up. So everything goes to the core. Another thing you can do if you're not seeing a lymphatic therapist is you can do self-care. And so skin brushing is an example of that. So skin brushing, it's a brush with a specific type of bristle, and you literally are dry brushing yourself. And so dry brushing towards the heart and towards the core. And sometimes when you do that, your skin will start to kind of itch or be irritated, and that's actually the lymph moving is what you're feeling.
Maybe some like neural activation plus the movement of the lymphatic fluids. That's cool. And so if I wanted to do this, it's always towards the heart, but if I had a dry brush, I would maybe start here like this and then work your way back.
Exactly.
And I've heard that if you don't clear those proximal areas first, you can actually make things worse. Is that true?
Yes. So sometimes it's kind of like with massage. If you have someone that is stagnant, that doesn't move a lot, and you put them on a massage table and you give them this amazing massage where you're flushing everything, it can be overwhelming for their body because it's not used to the movement, and people actually will get sick or feel horrible. And so the same can happen with lymphatic drainage.
If you don't do things properly, it can be counterproductive.
Yes, and also if you have someone who is not used to having fluid moved through their body, you might want to do a shorter session or half of a session to get their body accustomed before you continue on.
Cool. Yeah.
Just so it doesn't overwhelm their body.
Very cool. Very cool. Okay. Okay, so maybe I have heard about Chickley School and Vodder School, so to speak, like Chickley technique and Vodder technique. These are names of the people who originated these different versions. You were trained in Vodder technique,
Yes.
Is that correct? Okay, so maybe can you tell us a little bit about what is the difference between those two? Do you know much about Chickley?
I actually have not done research on Chickley's, but I was trained in Dr. Vodder's techniques, and he, the way, like if you look him up, there will be pictures of lymphatic drainage, and there are watershed lines. So basically there will be drawings of a body and then specific lines and dots and arrows, and it's basically where the lymph nodes are. And then a watershed line is where the lymph flows to. So you need to know where it flows to access the lymph nodes to flush them before you create the flow to that area. So
I'm not sure if I follow, actually. Can maybe just give that to me again? I know I could just watch it again, but maybe could you just give that to me again?
Yeah, here, hold on. I'll show you a picture.
Oh, okay. Oh, cool.
So
Okay, so these are like maps.
Yeah, so there's lines on there, and then the dots are the specific lymph nodes in the regions.
Okay.
And so you would drain to that lymph node.
Ah, I see.
So the areas kind of tell you where you drain to.
I see. And then the dotted lines are the watershed lines? Or what are the dotted lines?
Just a differentiation. So the right side drains to the right axilla, left side drains to the left.
Oh, I see.
It's kind of like the dividing line.
I see. Okay. So then what about the watershed lines? I think that's the part that I didn't quite follow.
So like here's another example. That might be a little bit more clear. The watershed line is the way that you do drain it. So
okay,
I don't
like a
know.
directionality?
Yeah, and I don't know if Chickley does that as well.
Okay.
So
I think think they do teach that.
Okay.
They're very specific about direction. I know very little about Chickley, and I don't think I know anything about Vater.
Yeah.
So, but kind of the way you describe it so far sounds like they would agree.
Yeah, I would assume that they would be very similar. There might be a few differences here or there, but then I don't know Chickley's technique. But I'm sure it's effective.
Yeah. I think if someone were to ask me what the difference between the two are, I think the only thing that I have heard is pressure modulation being different. I've heard that Chickley is a little more superficial with the touch, and Vater is like a little more deep with the touch. Maybe like Vater would be kind of like more in the center of superficial fascia texture, and then I think Chickley might even be like the 5 grams, like craniosacral type of pressure, like extremely superficial, like at the skin level almost.
Yeah. Well, I feel like the majority of the fluid that we're trying to move is between the skin and the fascia and the muscle. It's in that small area, and so pressure definitely matters. Too much and you're not in the right area.
And then not enough, and then you're not being effective.
Exactly.
Yeah. And I know in lab work, really most of the lymph nodes that I see outside of like right next to the spine, they're all in the superficial fascia layer.
Yeah.
So it makes sense to me that you would want your pressure to be kind of like in the center of that texture, which it sounds like what you're describing, right?
Yeah.
Yeah. Okay. I like these maps. These are cool. So the maps seems to be like a mission critical part of the education, like knowing which direction the things flow. Some of them are a little like they are the opposite of counterintuitive. They're very intuitive, some of them, but some of them I think you might have to like really study and kind of memorize, because some of them might not be so intuitive.
Yeah,
right?
It's definitely interesting. And in my practice, if someone doesn't want a full lymphatic drainage, like say someone comes in and they've rolled their ankle and it's swollen and they're like, oh, my ankle's swollen, can you help me? You don't necessarily have to do the full protocol. You can just clear the main area of the neck, which helps the lymph move, and then you can start on the leg. And so if it's the left foot, you would work the left hip first. So then you can drain the knee to the hip, the foot to the knee. The times where clients have not had success with lymphatic drainage is when you don't push the fluid past the joint. Because then the fluid just goes back to the foot and resettles.
Yeah, cool. It's funny that you mentioned ankle as your example, because I think the most dramatic example I've ever seen with my own eyes is a friend of mine. She was working on my grandma many years ago, and my grandma had this crazy swollen ankle. Like it was like straight all the way to just so swollen up. And my friend had just learned some Chickley stuff like a couple of weeks before. So I was like, oh, how interesting. You have an opportunity to help my grandma here, cool. And she just worked on her ankle, like just exactly like you said. She did the neck first. She learned properly, the neck first, and then the here, and then that's this direction. And just with like 20 or 30 minutes worth of work, within the hour, you couldn't tell any difference. But she woke up the next morning, and her ankle was like 0 swollen. Like it was like everyone's jaw was on the ground. My jaw was on the ground. My friend's jaw was on the ground because she had just learned it. This is the first kind of opportunity she had to practice. My grandma's jaw was on the ground. Like we were all like, oh my God, just this 20 or 30 minutes worth of work had a dramatic, extreme improvement. I couldn't believe it. It was really amazing. So ever since then, I've been like, okay, if anyone ever wants to trash talk lymphatic drainage therapy, they don't know what they're talking about. They haven't seen enough, because it was so obviously dramatically, helpful.
Well, now I'm going to throw something out that we do lymphatic drainage to pull the swelling away so that the ankle, so we can mobilize and move around. Is that a wise option?
Oh.
So it's great to know how to do it, but the swelling around the ankle is actually a protective mechanism, so the body can heal itself. So when we remove that, we think that it's healed. It might not be healed. So is it beneficial to do that?
Is it?
Depends.
It depends.
It depends.
It depends.
So we're in a society where it's like, I hurt my ankle, I do all this stuff. I got to get back to work right now. It might not necessarily be the best thing because the body does need to heal. So rushing back to things.
That's super interesting.
Puts it in perspective.
That's
I don't
very,
know.
very
So
interesting.
there's definite benefits to it, and it can be very helpful. But we can also rush the healing process that I don't know necessarily that we should rush.
That's
so
super
just an extra thought for you.
That's a great extra thought. So when do you think would be some examples of when it would be helpful to move that fluid out?
Okay, here's an example. So I'll have clients who will fly over from overseas, and so long airline flights and not moving on an airplane, and so then they have swollen ankles. That would be something where it's just a circulatory issue. It's not an injury. So that would be flush it, move it out, get them back to par,
Okay.
But
that's a good one. That's a good one. And then maybe would another one be like I have in mind a couple clients who I see who are like chronically swollen up. I got especially like 1 or 2 grandmas that I see in my clinic, and they got like a little pitting edema and the whole thing, and it's just like they're always swollen up.
It would benefit them.
I feel like that would be
95% of the time, definite benefit to lymphatic drainage. But sometimes you have like extreme athletes that are like, I got to get back out there. I got to do this. And they rush the process instead of letting their body heal on its own.
Yeah. So maybe like an acute injury, that would
give it a little bit of time. If the swelling doesn't go away, then you can dive in on it versus fix it immediately and,
Yeah. Super smart. Yeah. If you roll an ankle or break a bone or something, you need that swelling there
definitely
for some amount of time.
Do you want to talk about pitting edema for people that might not know what it is?
Sure. Tell us.
Well,
or I'll tell. It doesn't matter.
Go for it.
Okay. Well, so the edema is basically just to mean swelling of fluid. And then a pitting edema is specifically where, so let's say my wrist is all puffed up from extra fluid. If I put my thumb into it or a finger into it and then I remove that thumb, that indentation of my finger will stay. As opposed to here, if I sloosh my finger into it and then I take it out, on my body it fills back up immediately. But on these people with a pitting edema, it won't fill back up immediately. It takes some time. So what the difference between a non-pitting edema versus a pitting edema, I'm actually not remember. I think I must have learned it in school, and I think I did learn it in school, why the difference is there. But I am totally forgetting right now. Do you know?
I don't know what the main difference is other than pitting edema is pretty serious, and left untreated, if it worsens, you can actually lose a limb. I mean, it can, it can be bad. It also can be a blood clotting disorder creating it. So if you end up in the hospital with pitting edema, they'll definitely check for that.
For clotting issues.
As far as the pitting edema. But lymphatic drainage can be beneficial on that, and since you're not applying pressure, you're not at injury or at risk of injuring the area and the tissues, and so it can help with that. Yeah, cool. Yeah, I mean, I have this image in my mind of one of the grandmas that I work with, and she showed me her ankle. She was like, "Is this bad?" Oh gosh. You're like,
and I'm literally watching fluid coming out of her skin. Like she was leaking.
Yeah, that's a problem.
She was leaking out of her ankle, and I was like, she said, "Is this bad?" Like, ma'am,
you need to go to the doctor.
Please go see your primary care physician. Please go tomorrow, today,
gosh, No, right now. Do you need me to drive you?
From here, go to the PCP, please.
Oh gosh.
So yeah, oh my goodness. But she's still here with us. She's still kicking it.
Good.
She's super optimistic and enthusiastic with a smile on her face every time she comes into the office. And yeah, so anyway, she cracks me up. She's a sweet old lady.
Is this bad?
Yeah, is this bad? There's yellow stuff coming out of her skin, and it's very, very distinct pitting. Very distinct pitting. Yeah, totally.
Ooh, on that, there's one thing I want to talk about. Okay, here we go. This is it. So the lymphatics drain through the subclavian vein and the jugular vein into the thoracic duct. And so every 24 hours, 96 ounces of lymphatic fluid is filtered. So what that means is, are you properly hydrated? If you're not properly hydrated, the flow will be less, which will back everything up. So you want to make sure that you are properly hydrated for your own self-care to make sure your lymphatic fluid is moving.
Yes. One of the many, many, many reasons of why to drink water.
Yes.
Right? Why to drink fluid. Yeah, hydration. Yeah. I've even heard of some stories of people who had all kinds of issues, all kinds of issues, and the only thing they did was drink more water, and the issues would clear out. I've heard stories like this.
Absolutely, I agree with that.
Yeah, like no intervention from any therapist. Just drink some freaking water.
Yeah, hydrate.
Yeah, hydrate.
Just hydrate.
Yeah.
Now, if you're overhydrating only on water, you're going to run into a problem as well. You have to have the right mixture. So if you are very dehydrated and just chugging water, you can actually make it worse. You want to make sure you have electrolytes and other things.
And a right ratio and a right balance.
Correct.
Yeah, and in an ideal world, I think we would be getting a lot of these minerals from food. But I think the problem in our country these days is that the soil is very mineral deficient. So whereas maybe 100 years ago that wouldn't be a problem. You could drink even distilled water to a certain extent, and just eating proper food, then you would get that ratio correct of minerals to water. But I think maybe these days, maybe that's not as true as it once was.
Absolutely.
I don't know about that, but I think that might be the case. Yeah.
Definitely.
So maybe some supplementing water with some minerals. And I know you can buy little packets, right? And you can dump it into, right? Especially, I heard recently from Ryan, who I just interviewed this last time. He was talking about reverse osmosis water.
Oh, yes.
Yeah, he kind of made that same face too with the reverse osmosis stuff. He's like, it's not, if you do it, then you really need to buy packets of minerals and
It sounds great, but it's not.
Yeah.
It's not what we need.
Yeah, because it takes too much out of the water. Is that right? Yeah. Cool. So what other stuff you got written down there? Is this? I don't know if it would be out of context, but I want to make sure we get through everything that you wrote down there.
Oh yeah. So on here, different conditions that are improved by lymphatic drainage.
Oh yes.
Yeah.
Yes.
Everything. But being specific, edema, which is swelling, eczema, which is like skin irritation. So our skin is our largest organ of absorption and elimination. And so if we are toxic and we're not hydrated, our body has to get rid of those toxins. And so we will actually sweat them out, and that can irritate the skin. And sometimes with that, you'll end up with eczema. Allergies, arthritis, chronic headaches, trauma, all these things, having your lymph system working correctly can minimize and help out with those.
I'm still stuck on the eczema one.
Okay.
I'm sorry.
Okay.
I'm sorry, but that's so interesting to me. The way I'm understanding it, you tell me what you think about this. Tell me if I have anything about this that's off. But so instead of the stagnant, toxic stuff exiting through the skin, if you move it with the lymph, then it doesn't have to come through the skin and irritate the skin.
Exactly.
It can get processed internally through the lymph nodes. That's so interesting.
So you can actually clear up skin conditions by having a healthy lymphatic system.
That's so interesting. I've never heard of that. That makes a lot of sense, though.
Here's something that's fun. Sweat. So when we sweat, depending on what we eat or what we're doing with our bodies, your sweat can smell different at different times. So our sweat is not actually what is smelling. It's the bacteria that's living on the skin.
Yes.
That creates the smell.
Yes.
So let's talk about antiperspirants. So antiperspirants actually block the cells so you can't excrete. So you don't smell, but you're blocking right at your axilla where your lymphatic tissues are. And so antiperspirants can actually be very dangerous and toxic. And so...
Yeah, you don't want to block up those channels.
No.
Yeah, no, that makes no sense. And antiperspirants are different from deodorant.
Yes, and there's different types of deodorant. One that's actually pretty good, I think, right now on the market is called Native, and they use coconut oil. So coconut oil is naturally antibacterial, and so it will actually kill the bacteria that lives on the skin that is making the smell. It doesn't block us from sweating.
Yes.
So that's kind of an awesome one that's out there right now.
Yes. Taking care of bacteria on the skin is totally different than blocking the sweat channels.
Correct.
And blocking the sweat channels is by definition the antiperspirant. Mm-hmm. Yeah. And I think what they is it true that what they use for antiperspirants are metals?
There are some metals in it.
Like literally aluminum. Mm-hmm. Like you don't want to put
metal
microscopic
on your body
aluminum.
That you're gonna absorb and...
Yeah, no, that's a terrible idea. It sounds like. Yeah.
Absolutely.
Yeah. So could I just do like a little coconut oil in my armpit?
You could actually.
You could, and it really would probably be helpful.
Mm-hmm.
Maybe if you drop like a couple of drops of essential oils or something, then you could like make your own.
Ooh, let's talk about that.
Okay.
So, essential oils are wonderful. They smell great. You can pick one. Essential oils have to be diluted. So if you just take regular essential oil and put it directly on your armpit, you will create a problem. You can also create allergy. So you want to dilute the essential oil before you apply it if you want to use essential oils as a deodorant, especially because the axilla is such an area for absorption. So dilution rates for normal essential oils is 5%. So you would take your mixture of coconut oil, put your essential oil in at a 5% ratio, and then apply that. But don't just apply the oil directly.
Yeah. And would you get that ratio correct by like weighing it or measuring it like in a measuring cup kind of thing? Or
I think if you do 1 ounce of the carrier oil, it's 5 drops of the essential oil. I believe that's how you do it.
Nice.
I could be wrong, but I'm pretty sure that's how you do it.
Yeah, we'll double check, but something like that, something in that ballpark.
Or if you had the coconut oil, to be exact, if you had the coconut oil in a liquid form, 100 drops of coconut oil to 5 drops of essential oil.
Nice.
That might take a long time
to
drop.
Yeah.
But you could do it.
Yeah. Nice.
So just be aware of that. And then different essential oils have different properties. So they have emotional attributes as well as medicinal attributes. So that's a whole nother rabbit hole.
I was going to say,
we could go down.
That sounds like a whole other thing.
Mm-hmm.
Yeah, okay. So now let's go back to that awesome list of things that it can help with. So now that I'm good on the eczema, what was the next one?
Yeah, okay. Allergies, arthritis.
Allergies. How would it help with allergies? I mean, I guess I could see, but
if someone is allergic to something, like for instance, we'll say pollen. If they're bringing pollen into their body, so you're breathing the pollen, and that particulate gets into your body and starts irritating it. If your lymph is healthy and happy, it can help filter it out faster.
I see.
Food allergies.
I see.
You just kind of have to know your body and what it needs and steer clear of what it is that makes you allergic. But if your lymph system, if you have something that you are allergic to in smaller amounts and your lymph is happy, you should be able to transition it.
Process it easier. Yeah. It's interesting. Allergies is something that in chiropractic care is very classic. Like chiropractic adjustments are very helpful for allergies in general. That's another one. And so
that's awesome.
Right? And so that's interesting that with the lymphatic drainage you can also help with that stuff. It's kind of not surprising to me in a way.
Yeah.
We have so much overlap in the benefits that we have with the different bodywork modalities, right?
Mm-hmm, definitely.
Yeah.
Well, and arthritis ties into both of those. With chiropractic being able to help arthritis, and then if your lymph system is functioning properly, it can help pull the inflammation out of the joints and create
Yes, because arthritic processes are inflammatory processes. Mm-hmm. So if you can have a good lymphatic circulation, then that inflammatory process is going to be moved along instead of staying in those joint spaces, right? Yeah, that's cool. That's very interesting. Okay, so what else is on here?
Let's see here. Chronic headaches, stress, mental confusion, respiratory disorders, breast tissue issues, so like cancer.
Like preventative,
Mm-hmm.
as well as cure. Oh, I shouldn't use that word, but
Okay,
management. Can I use that word?
So with lymphatic drainage, when I do a massage and you're on the table and you undrape someone's back, if you have a female client and you undrape their back and you can see the indent from their bra straps or their bra lines, that's a problem because that's restricting flow. And so we put our girls in bras, and it actually is not helping with breast issues. A lot of bras have underwires, and so then you have metal directly on your skin. So that also is not beneficial. So
seems very uncomfortable.
Yeah.
Like just the idea of having to tie something around my chest and wear that all day. Just the idea of it is uncomfortable to me, even though I've obviously never worn one, but yeah, no, and it's, I don't know, maybe 4 times out of 5, maybe 9 times out of 10, whenever I work on females, my attention is so much called to that like T10 sort of area where that bra strap is. Like I'm always sort of like drawn into that area just to give some adjustments, give some work into mobilize those vertebrae that are being tied up by that bra strap. It
makes a huge difference.
Right? Yeah. And then I'll give that nice good adjustment, get that release, and the ladies go, it feels good, right? Because it's all literally it's being tied up. So yeah, that makes sense that the lymphatic stuff would help with that too. Yeah. Headaches makes perfect sense to me. Definitely. A lot of headaches is from stagnation of stuff.
Everything. Yeah.
Right. So yeah, that makes perfect sense.
Definitely. Tinnitus, ringing in the ears.
Tinnitus.
Yeah.
I would not have thought of that one.
Yeah.
You have an idea of how that...
That I have no idea why it affects it. But,
I don't know either.
But that sounds good to me.
Yeah. Maybe like a neural regulation kind of comes to mind for me, because even like whenever we're doing some very specific technique, like a lymphatic drainage, for example, we're not, as much as we are doing what we think we're doing, which is moving lymph, we're also affecting other systems simultaneously, right? Like you can't ever narrow a technique down to just doing this one thing. I think that's underselling techniques.
It affects everything.
It affects everything all at once, right? And so definitely it's affecting neural
pathways.
Neural pathways, thank you. It's definitely affecting neural pathways whenever you work this lymphatic system, because the nerves and the lymphatics run together. They're best friends.
Yes, they are.
Right? And so that makes sense that you could kind of like affect neural quality through a lymphatic technique. That makes perfect sense, actually.
Yeah, and inner ear balance, equilibrium, fluid flow, all of that ties in.
Nice. So. Yeah, nice. Very cool.
There were other things on the list, but I didn't write them down. Contraindications.
That's a good one.
So contraindications for lymph work would be blood clots, because you are moving a lot of the fluid. If someone is susceptible to blood clots, that could be a problem. Let's see here.
Because you don't want to move those blood clots through.
No. Pacemaker. If they have a pacemaker, you do not want to use anything with an electrical instrument on them, which brings me to, I didn't talk about this yet, but the LymphStar. There is a machine called a LymphStar that my instructor used, and what he would do, it kind of looks like a wand, and back in the day, you'd go to the mall, and there would be this ball, and if you touched your hand to it, the light would come to your hand. You know what I'm talking about?
Yeah.
So there's this tool that literally looks, you touch it to your skin, this light jumps to your skin. And, but anyway, so it's called a LymphStar, and it breaks up congestion along the surface. And so he would do a half-hour session where he would literally manually use the LymphStar all over the body to break up the congestion, and then he would do his manual drainage, where he would clear the areas and filter things through. So in an instance like this, if someone had a pacemaker, you would not want to use the lymph start on them.
Got it. But manual work would be okay?
Manual would be okay if they have a pacemaker.
Okay. Yeah, when I was like 11, those balls were the coolest thing
I know,
in the
right?
whole world.
Well, imagine my surprise when I'm in a lymphatic drainage class and they bring this thing and I'm like, what is that?
Yeah.
So I was very much so skeptical. I'm like, what is that? Why would you pay money for that? What is it? It is vibration science. It provides information in the form of harmonics and sound with light energy to the cells. The result of the application is breaking up the blockages through the repolarization of proteins, is what this machine does. It's a whole lot of, I don't know.
That's a lot of words. But you're still talking about the electric.
Yeah, the lymph star.
That's all. Okay.
So that's what the lymph star technically does.
Got it.
And so you can buy a lymph star yourself. They're like $4,000 or $5,000, and you can manually break up the congestion in your tissues. So I've had clients who have had cancer who will buy one of those machines and do that, and then do the skin brushing to help with that.
And that's helpful.
Mm-hmm. It has seemed to show good progress for them.
Yeah, very cool. And would that be specific to lymphatic cancers or any type of cancers?
Any type of cancers.
Because even with non-lymphatic cancers, I assume that moving lymph fluid would be helpful with that process, even if it's indirect.
Okay. So cancer with massage it's a fine line, because massage therapists are taught to get doctor's permission in order to do massage on clients with cancer, because my view is massage is definitely beneficial for helping with cancer. Other people's view is if they have cancer and you give them a massage, you can spread the cancer.
Yes.
And so there's a fine ratio. I have quite a few clients with cancer, and so them understanding and knowing that it could be a risk, but also quality of life. I mean, there's a whole range of these things.
That's a complicated topic to navigate.
So some people will say lymphatic drainage is contraindicated for cancer because you could push the cancer into the lymph and it will spread throughout the body. My take on it is the lymph is our immune system. Let it handle it. But, I mean, there's a whole,
That sounds like a complicated thing to navigate.
Definitely.
Yeah. And I can see both sides. Like, both of those arguments kind of make sense to me.
Mm-hmm.
And I've heard it also, too, that a lot of body work is contraindicated for different types of cancers. I've definitely been, I have been taught that also. And, I don't know.
I think it depends on
That's
the individual. And so massage therapists having the knowledge and understanding and being able to educate the client and letting the client make the decision of, I'm choosing body work or I'm going to hold on that, you know?
And I think either direction would be valid and,
absolutely,
and fine. Yeah. Just kind of whatever that person wants, for their life, right?
Mm-hmm.
I know a very dear mentor of mine who just passed recently. His opinion was, if I get like a stage 4 diagnosis, I'm gonna go to a tropical island and
I would join him there.
Drink juice and make love to my wife, and and let it do its thing, instead of the
prolonged.
Yes, exactly. So it's just like, it's not a right or wrong. It's just, what do you want for your life?
Mm-hmm.
And I think that's an honorable. That was his choice is an honorable choice, I think.
Yeah, there's the extension of life, and then there's the quality of life, and you have to choose which end you'd like and how to balance.
Yes, and if the body work is improving your quality of life, then,
Exactly.
Yeah, okay.
Very good point.
Yeah.
Let's see here. So, cancer could be contraindicated. This one was interesting. Breast implants, pins, staples, metal plates. That would be contraindicated because moving the lymphatic tissue, if it's moving the tissue the body might recognize those things as not part of the body and try to reject them. So
Interesting. I would have thought exactly the opposite.
I know. Well, and I do lymphatic drainage on clients who have had breast implants on a regular basis.
Yes.
And can be beneficial because with breast implants or mastectomies, lymph nodes have been moved or rearranged or eliminated, and so then you can end up with swelling issues. And so lymphatic drainage has been very beneficial in those instances. But they do put in the curriculum that it is contraindication.
That it's contraindicated. Yeah, that's super interesting to me because I kind of more or less firmly believe the exact opposite.
Yeah, I know.
You know, because
exactly.
like I've seen in the lab over and over and over encapsulations around these so-called foreign objects. You know, that's what the body will do. If the body can't digest it or eliminate it, it'll encapsulate it, right? And so like with something like a breast implant or like a metal plate or a screw, you know, to tie things back together like a broken bone or something, you can't digest it, you can't eliminate it, so the body's going to put a capsule around it. And so if you let that capsule just be, then that encapsulation will become more and more hard, you know, and more fixed. And if you just kind of give it a little bit of love, you know, let's say you have a plate in your clavicle and you kind of like work that soft tissue around the plate, then it'll keep that capsular material more mobile, you know, more fluid, more soft instead of getting harder and harder. And I feel like that hardness would get uncomfortable.
And becomes restrictive. And then it not only is your clavicle, then it starts working its way to your shoulder.
Totally.
Yeah.
Yeah, totally.
Yeah. So
totally.
I'm in agreement with you on that, even though the curriculum says otherwise.
Yeah. Yeah, how would... Because the thought process in the official curriculum would be that you don't want there to be any rejection. Did I understand that correctly?
Yeah. Because it's a foreign object, and if the body is at true health, it recognizes it's a foreign object and then tries to eliminate it.
Unless it doesn't. Unless it doesn't, because another thing that I see over and over in the lab, especially with prosthetic joints, something that blows my mind continually, is that the soft tissue around a prosthetic joint, like if you get a knee replacement, for example, I see this over and over and over again, a knee replacement, and the soft tissue and fascial stuff will like infiltrate and like get to know that new material and incorporate that new material into the rest of the system. You know, and to me, when I see that, what goes through my mind is what an incredible intelligence that this is assimilating this foreign object to like make this thing part of yourself, you know, and it's just like an adaptation, you know, that's how I see it, is as an acceptance and as an adaptation into the system. And, you know, so I don't know, I feel like a healthy and well body would, instead of reject some foreign object, it'll accept the foreign object, actually. So I don't know.
Yeah, I think we're going to disagree with that.
Yeah, respectfully.
Yeah,
you know,
exactly.
it's good to be cautious. Like, you know, caution is good, and also, you know, faith and confidence in our human body, I think, is also good. So I'm glad that we're in agreement on that.
Absolutely.
Yeah. So you got any other notes that you want to shout out here?
One last thought. All the lymph nodes are structured the same. They're storehouses for lymphocytes, antibodies, and immune cells. So it doesn't matter if it's microscopic or if it's one that you can feel in your neck or if it's one in your intestines, they're all structured the same. So that's kind of fascinating. That
is fascinating. It's a very fancy Easter egg, right? Yeah, very, very fancy Easter egg with a lot of really interesting stuff going on inside of that. This is something I don't know anything about, and I don't know if you know or don't know, but what the inside of these Easter eggs, what the inside of these lymph nodes, how they do their processing of this fluid. You know anything about that?
It deals with the interstitial space and fluid regulation, and so it's a pressurized system. And that's about the gist of what I know.
Yeah, nice.
But there's fancy pictures with cells and the way that if the cell gets too full, then it stretches, and then that's when you get edema and swelling because the fluid leaks out. And so, it's my brain is not a chemist's brain. They would understand it like that.
Yeah, that's like a histological question. Yeah. And I just, I've seen so many lymph nodes in the lab, and some of them can be quite big. Mm-hmm. But, when you look at something at the gross level, and it's just barely the size of a lentil sometimes,
mm-hmm.
And you're like, you can't get on the inside of that. You need a microscope and very fancy techniques and staining techniques and all this kind of stuff. And that's totally outside of my training. I don't,
mm-hmm.
I barely spent an hour looking through a microscope inside of, while I was in school. So that's not even 1% to really learn these kinds of things. But that would be cool to learn a little bit about how a lymph node does its processing of this fluid that's getting pulled into it. Yeah. Quick question, because I mentioned that I'd like to put this up on the screen, but I see a copyright. Is it okay that I put this on the thing, or should maybe we shouldn't?
I think we can. The other option is if you Google Dr. Vatter's lymph, it will. I'm sure you'll pull up pictures that are website accessible.
Okay, cool. So maybe just to respect this little copyright sign down here, maybe I actually won't put this picture into the thing. But for people at home, a quick Google search, you will probably find this a very similar map.
Exactly.
And what would you say, lymph flow map? Because
or you could say lymphatic watershed map.
Lymphatic watershed map. Okay, cool. All right, cool.
I think that would pull up the pictures.
Okay, cool. So here's another question. Do you have any cool stories like the story that I had with my grandma with her ankle?
Oh.
Do you have any cool stories that you could share with us from success and that success moments you've had with lymphatic clients?
Yeah, so there is a thing called lipedema. Not lymphedema, lipedema, where the lymphatic cells actually store fat. And so based on what you've heard from us, the lymph needs to flow. If the Easter eggs are holding fat, it's shutting the whole system down, and it creates issues. So I've worked with a few clients who have had lipedema, and basically they have to get the fat removed from their cells. And so they will come to me for lymphatic drainage. I will move things as much as possible, and then they go see doctors, and it's almost like liposuction for your lymph.
Wow.
I'm like, is this even a thing? I hadn't heard of it when I had a few clients come to me with this, and I'm like, oh my gosh, that's intense. But anyway, so they go to doctors and have it removed and have to wear compression stockings, and then they'll come back and have lymph treatment, and it's been extremely successful in them having correct lymphatic flow through their bodies and getting their bodies back. So it's pretty exciting.
So is what you're saying that with the lymphatic drainage therapy, the medical doctors don't have to do their procedure, or that it's helpful?
It's two separate things. So lymphatic drainage is one thing. The lipedema is something else. But lymphatic drainage can help lipedema.
It can help lipedema.
It can't fix it, but it can help it.
It can help it.
Mm-hmm.
Yeah.
And then with doctors and the surgeries, then it can be fixable.
Oh, okay.
So to speak.
Yeah. I've heard that lipedema can be very painful.
Mm-hmm.
Yeah. I don't know a ton about it, but I've heard it can be painful, not good. So that's cool. So you've had a number of clients.
Success story. Mm-hmm.
Very cool.
Yeah.
Awesome.
And then similar to your grandma, clients that come in with rolled ankles and you cannot see their malleoli. It's like, where's your ankle bone? And you do a draining in one session, and it's like their bone is back, and it's like,
wow.
I mean, it's amazing.
So. Very cool.
Pretty cool.
Yeah. Very, very cool. I like it. Okay. Do you have, maybe this can be one of our last questions, if not the last question. What advice do you have for people who are looking to get into the healing arts in general? And then part two of the question, what advice would you have for people who have already graduated from school and who are already practicing? So two advice questions.
Yeah. For people that are looking to get into the healing arts, I would say find out what you're passionate about and dive into it. If you love being outdoors and exercising, dive into that and see how you can better your body in those ways. And then as far as students after they've graduated and learned, I'm a life learner. I've been doing massage 20 years, and there are all these new things, and there's so many techniques that I would like to learn and know. And so my advice would be never stop learning.
Nice.
You know, every time I go to a course or a seminar and I learn new things, it just reignites that fire for the body and knowledge of the body. And so my advice would be find a class that you think you're interested in and try it out and see where it takes you next.
Yeah, very cool. So for the first one, for finding out the thing that is exciting to you,
Yeah.
maybe would be what could be some resources that people could check out. One thing that comes to my mind is hanging out at the offices of people who are doing this work already. That was a hugely important part of my journey. Was, I went to chiropractic school, and before I went, I hung out with a couple chiropractors, and I found that was just so important, to really kind of like see what it's like on a day-to-day basis and see the clients that come in and how it helps with them. And so maybe that's, if I could add on to your bit of advice, that's how I would say to find different offices and hang out with them for a little while and see what it's like to be in their office and do their work. But do you have any, so that's that. And do you have any other ideas of how one might find different things that would make them stoked about this world?
We are in such an internet phase. The internet has so much knowledge and information, and thinking back to pre-internet, where I'm from, it's right at the tip of everyone's hands. So if you have a question, Google it, research it, find the information, ask the questions, delve into it. But yeah, mentor.
Do some homework, do some research online, and
yeah, there's so many different healing modalities out there. I mean, so many.
Yes. Yeah, cool. And never stop learning.
Yeah.
That's such an important one, I think, to never stop learning. I'm with you. I'm a lifelong student, and a big part of the reason I want to have these conversations with people exactly like you is that I get to it's another way that I get to keep learning, and so I love that. So hopefully this podcast can be one of those resources for people to keep on learning, whether you're before school or in school or graduated already. Maybe this can be a resource for people. But if not, my goodness, there's so, like you said, there's so many classes and so much stuff. And yeah. And if I may, I have to give a shout out to the lab. Dissection work is just so extraordinarily powerful to stay in the student mindset and to keep learning, because every body that we learn from is so different. We get such different views and we get such different variations that we can see, and and then you make one cut one way and then the next one you make a different cut a different way and you see it differently, and and then the variations of the textures from person to person. And it's just like, it's extraordinary how much you can continue learning through the dissection process.
Well, I'm going to add something to that. So the lab that's at the massage school, when I went to the lab, I had been in and out of cadaver labs, but at this lab, I have to shout out to Bonnie Thompson. She started this lab, and she's brilliant in her knowledge. And we were in the lab, and we were working on the erector spinae muscles. So they're muscles along the spine, and there's different depths, and they have different angles. And so we were palpating them, and she had dissected them down to the deepest level and she had me palpate it, and then she put another level on and had me palpate it and palpate through it. And she just layered it up. And then we went into a separate room and we had clients on tables and we palpated through, and you could tell which level of erector spinae you were on through skin. And it heightened my knowledge of the spine exponentially. It changed the way I did body work. And if you can get a good spine treatment, you're golden, So
Yes.
That lab has definitely blessed me.
Yes, it's everyone who's walked into it. I think it has blessed. It's been an enormous blessing for me, and I love that shout out. Definitely to Bonnie. What an angel Bonnie has been for so many people, including me. And feeling those textures in isolation, and then feeling those textures all together.
You can differentiate.
Definitely.
It's so cool.
Definitely. And you can't get that from a book or from a PowerPoint or from a plastic model. You just can't. Because it's a textural thing. It's not a theoretical thing in your mind, It's a textural thing in your hand. And the only way to get that is to feel the real thing. So, yeah, I'm so glad that you've had such profound experiences there. I definitely have, and I look forward to us both having more.
Absolutely.
Yeah. Cool. Well, do you have anything else you want to shout out to, or maybe a question for me, or anything, or does that feel good?
I think we're great.
Yeah? All right,
Yeah,
cool.
That was amazing.
Cool. Well, thank you so much for chatting with me. I love this. You're an amazing person. I'm so glad to have you as a friend in my life, and thank you for talking with me.
Thanks for having me today.
Yeah. And thank you everybody for listening and watching. Bye-bye.